This is the launch of a research report with the title, The Influence of Livestock-Derived Foods on Nutrition During the First 1,000 Days of Life. This is a joint work together with ILRI and Chatham House. And Chatham House, as most of you probably know, is situated in London and stands for the Royal Institute of International Affairs, and ILRI is the International Livestock Research Institute. And this work has been funded through Chatham House from Bill and Melinda Gates Foundation, and through ILRI from two CRPs, Agriculture for Nutritional Health and Livestock. We should move to the next step, and Sylvia, welcome up.
So my name is Sylvia, and my role here today is to take you briefly or give you an overview of the report. I'm going to tell you a little bit the background, where it came from, and what we did, and actually what we found, because that is the topic of discussion during the panel. So let me tell you a little bit of the background, where this idea came from. So for those of you with connections to the North, or what we call developed countries, there's a big debate now on the role of livestock on environment and environment degradation. So there's more and more international calls for reducing or even stopping the consumption of animal source foods, or livestock-derived foods actually, because they contribute a lot to environmental degradation. So the Chatham House has been working a lot on this topic. They are interested on looking at ways of delivering healthy diets in sustainable ecosystems. And with all these calls about where we should all move to plant-based diets, they are starting to realize that maybe there could be an issue of leaving behind some vulnerable groups, especially in low and middle-income countries, that may actually benefit from consumption of these products. So with this idea, Chatham House commissioned ILRI to do this work. We were working together. And we wanted to answer specifically 3 questions. So one is LDF. I'm going to call it LDF because it's shorter. So LDF, livestock products, do they really have a role in contribution to nutrition in the first 1,000 days of life? The second was where livestock interventions can be used as a pathway to obtain nutritional outcomes in children. And then beyond nutrition, we wanted to look at the health and environmental externalities of consumption of LDF. Now, 2 things about the report. So it focuses on livestock products, so it's not animal source food. So it includes milk, meat, and fish, but excludes fish. And in the previous presentation, someone was saying fish is always left out. So indeed, we left it out, actually. And the other thing is that it targets the first 1,000 days, and probably most of you know that, but just in case someone doesn't know it, first 1,000 days includes the time from conception up to roughly 2 years. And it's, the contribution of consumption of LDF at that stage in nutritional outcomes at that stage. So in these 10 minutes, I'm going to just talk about these first 2 questions, because I think those are the most relevant for this conference. So what did we find when it comes to impacts on livestock-derived foods, supplementing diets with those in the first 1,000 days? So we conducted this big systematic literature review, sort of screened more than 1,600 abstracts and titles, but after all our very tight inclusion criteria and quality criteria, we only ended up with 13, which was a bit disappointing, but not surprising, actually. So there's very few studies, and probably, those of you that have been working on this know this, there's very few studies, mostly on milk and meat. There's very few on eggs or poultry meat, for example. On the first 1,000 days, there were only 3. So indeed, we have to expand our time range to cover until 18 years, because otherwise we will have ended up just looking at 3 studies. And the quality is relatively variable. I think there's more and more work being done, and that is getting much better. But at the time we finished our review, the papers we had, the quality was quite variable. But anyway, still we have to draw conclusions, or at least put together that little data. And I think what we found actually confirmed things that have been said for a long time, which milk might be associated with seems to be promoting linear growth. Meat is rather related to cognitive development. That the effect of livestock products might be, or the impact will be better on undernourished children. And this is all children up to 18 years. But in terms of micronutrient status, there's not really very much clarity on whether they contribute or not, and I guess it depends on the rest of the diet to a certain extent. So people are asking us, so what do we do? What do you say from this? Couple of things. So more research is needed, I guess, and of higher quality. There are things like, for example, the dose-response relationship. So what is the difference if you get, 100 grams of meat, or if you get 200 grams? So if you get 50 milliliters of milk or 200 milliliters, what is the different effect on that? And also, there's really no studies on the effect of women breastfeeding and pregnant women on how does that goes for the child in the first 2 years. So there's a lot of things that could actually be looked at. But the limited evidence seems to be rather positive more than negative. So I wonder, do we have enough evidence or not? Can we stop here or should we do more? So just a question that I throw to the floor. So the second question that we looked at, it was livestock interventions and the effect of nutritional outcomes. So that, what we wanted to answer is there a rationale to be promoting, livestock interventions as a way of achieving nutritional outcomes in children? So then it gets much more messy because the linkages between livestock production and eventually nutritional outcomes in children are very complex. And I don't expect you to be able to read that clearly. But it's to say it's just not such a linear relationship. So actually, disentangling the effects of livestock intervention is complicated. Anyway, there's been a lot of reviews over the past years. So we just pulled together all those reviews and tried to make sense of them and say, what are they telling us? So it seems that livestock interventions, if they are done well, they can actually improve the situation at the household level, at the farming households. So they improve the yields, they increase the amount of livestock products that are available, they increase incomes, and they actually can impact on factors that are determinants of malnutrition. They do that, or at least the evidence that's what it says, if they are done well. They can, because some studies have shown that they seem to also lead to changes in diet, patterns of diets, and also some studies have shown improvements on macronutrient intake. And none, to what we know, we couldn't find studies that have actually linked them to nutrition indicators, so anthropometry and those things. But because they impact the previous steps that I presented, we expect that they may actually impact on those, but there's not very clear evidence on that. But something else that the literature seems to be saying when it comes to livestock interventions is that they could do better if, for example, they are coupled with other interventions like WASH and education. So livestock intervention per se, if we really look at nutritional outcomes, might not actually be enough to deliver outcomes. And the other thing also, when you target women involved then in the livestock intervention somehow has them as the target, they seem to also provide better outcomes. And also what most of the studies report is that it seems that the livestock interventions somehow, because they affect many aspects of that complex pathway that I show, they can actually maximize, create an environment, an enabling environment that can facilitate nutrition-specific interventions to be more impactful to delivering nutritional outcomes. And the final remark on when it comes to livestock interventions and nutritional outcomes in children is that pretty much all of the studies that are available now, they look at rural households. So they measure, what happens in the farming households and maybe in the communities around it. But urbanization, there's a move to being always farther from the households, and a big chunk of the children are actually peri-urban and urban children that have no relation to livestock production. So we have to start looking at those value chains, and then even gets more complicated. So how all these steps of the value chain can actually impact on nutrition on those children, because probably what happens at the farm level is too far. So there's more and more studies being done on that, but there's not much sort of yet available or readily available evidence as of now. 3 messages for now. There's lots of work to do, so these people in this conference should be doing a lot of work on this area because we need more work and more understanding of the issue. We have to embrace complexity. This is a complex issue, and I think we all want to simplify. And I come from epidemiology. We always want, the things that are normally distributed or very similar or perfectly defined. But actually, it's complex, and we cannot get rid of that. And if we have to understand it, we have to understand that complexity. And my third question is, when is enough evidence enough? So I walk around and people tell me, so do we have to give children livestock products or not? And I say, well, good question. So I'm not really sure, and I guess this is for the nutritionist. Like, do we have enough evidence? Is this enough? And if it is not, when do we stop? So I don't have an answer, clearly, but I hope that the panel that will now cover this and other areas will help us, take us through that. When is enough to act? When do we start taking action on this information? Thank you.
How relevant is this report and its findings to your field of expertise, and why? And I turn now to Namkolo Chovic first.
From my experience, I think there is some relevance in terms of the evidence that you have provided in this report on agriculture, nutrition, and health outcomes. Definitely, there is reason to increase consumption of livestock-derived foods to get better outcomes for both nutrition and health. First, to start with nutrition is because of the linkage